Anesthesia is an important part of surgery that will be used to manage pain and discomfort during your upcoming joint replacement procedure. There are 3 types of anesthesia: general, regional, and local. For joint replacement surgery, local anesthesia is not used, so it will not be discussed. You will, however, be offered general or regional anesthesia. While general anesthesia is a safe option, many surgeons and anesthesia doctors prefer to use regional anesthesia. Research shows that regional anesthesia is even safer than general anesthesia, and it can reduce some of the common complications that go with general anesthesia, like nausea, vomiting, and sore throat. Regional anesthesia also decreases your need for pain medications during and after surgery that can make nausea and vomiting worse. In other words, regional anesthesia can improve your recovery experience with less pain and fewer side effects. Your anesthesia doctor will discuss with you the type of anesthesia and pain management that's right for you on the day of your surgery. He or she will also talk with you about the risk factors of the plan the 2 of you decide on. These are based on the procedure you're having, your personal health history, medications you take, and your age. Don't be afraid to ask questions and discuss your concerns. Patients who are having joint replacement surgery usually receive a combination of either general anesthesia with a peripheral nerve block or regional anesthesia with a spinal and a peripheral nerve block. In all cases, the final decision about what type of anesthesia you receive is up to you, the patient. General anesthesia puts you in a deep sleep that keeps you from feeling pain. You will go to sleep with medicine given through your IV. An IV is a small tube inserted directly into a vein, usually in your arm or hand. Once you are asleep, a breathing tube is placed in your mouth and down your throat to your lungs to help you breathe and to keep you in deep sleep until your surgery is over. The breathing tube is usually removed in the operating room before you wake up. Common side effects of general anesthesia can include nausea, vomiting from the medicine that keeps you asleep, and a sore throat from the breathing tube. Regional anesthesia is used to block pain at the surgical site by placing numbing medicine around the nerves that send messages to your brain. For joint replacement surgery, a single dose of numbing medicine is given using a needle. If the injection is directed at a particular nerve group, it is called a peripheral nerve block. If it is placed in the back, it is called a spinal block. It is important to know that even if you and your provider choose regional anesthesia as the plan for your care, you will still be asleep for your procedure. You'll be given medicine through your IV that will keep you sleeping, but not as deeply as general anesthesia, so that you will be able to breathe on your own without the help of a breathing tube. Spinal anesthesia is given in the operating room right before surgery. A single dose of numbing medicine is injected into your back. Very quickly, you will not be able to feel anything from your waist to your toes. The numbness will begin to wear off after your surgery is over and you are in the recovery room. A peripheral nerve block may be done before or after knee replacement surgery. If the block is done before surgery, you may be given medicine in your IV to help you relax. You can expect your knee to be numb over your incision for about 12 to 18 hours after surgery. This should allow you to move around and participate in early physical therapy with very little discomfort. After the nerve block wears off, your surgeon may prescribe pain medicine to be given through your IV or for you to take by mouth, or both. While you're in surgery, your care team will closely monitor your heart rate and its rhythm, your blood pressure, breathing, and oxygen level to ensure your safety throughout the entire procedure. They will continue to care for you after surgery in the recovery room until you're comfortable, your vital signs are stable, and you're ready to move to your room to begin the next phase of your recovery. If you have any questions or concerns about anesthesia for your joint replacement surgery, please let us know. Thank you for allowing us to be part of your care team, and good luck.